And finally, for the posterior compartment of the leg, we have the flexors or the plantar flexors. These muscles are subdivided into a superficial group and a deep group. The superficial group consists of three muscles, which are the gastrocnemius muscle, the soleus, and the plantaris. The deep group consists of the popliteus, flexor hallucis longus, flexor digitorum longus, and the tibialis posterior. Starting by the superficial group, for the muscles of the posterior compartment, or the flexors, or the plantar flexors of the leg, we have two groups, the superficial group and the deep group. The superficial group of muscles of the posterior compartment, we have three muscles: the gastrocnemius muscle, the soleus muscle, and the plantaris muscle. Talking about these three muscles, first we have the gastrocnemius. Gastro means stomach, cnemius means foot, so we have belly of the foot. Together with the gastrocnemius, we have a broad muscle just below it, it's the soleus muscle, and the two muscles together are similar to the triceps muscle of the upper limb, and so-called the triceps shorei. The gastrocnemius originates with two heads, lateral head from the upper posterolateral surface of lateral condyle of the femur, and a medial head from posterior surface of medial femoral condyle, popliteal surface of the femoral shaft. Both heads insert in the posterior surface of the calcaneus via the calcaneal tendon. The muscle is innervated by the tibial nerve and helps in foot plantar flexion and leg flexion at the knee. The soleus muscle originates from the soleal line, medial border of tibia, head of fibula, and posterior border of fibula, to insert in the posterior surface of calcaneus via the calcaneal tendon. We can imagine how these two muscles, together with the plantaris, forming the Achilles tendon, which is away and out of any retinaculum around the ankle. It's innervated by the tibial nerve, vascularized by the posterior tibial artery and vein, and helps in foot plantar flexion. The soleus muscle have an important clinical correlation, which is the soleus tear or the soleus vein. This tear usually occurs in runners or people who overuse their feet. Athletes specialized in long-standing and endurance running or walking, which require constant soleus action, are at high risk of injury. The symptoms are lateral calf pain on either side of the soleus, weakness in the calf and weak plantar flexion, especially with flexed knees, and exercise-related dull calf pain. The treatment includes wrist, icing, compression, and elevation. A soleus tear needs to be differentiated from gastrocnemius tear, which is usually a sudden injury caused by quick movement, such as jumping and sprinting. And that tear, the gastrocnemius tear, is called the tennis leg, and we will talk about it. The soleus pain might be a symptom of a soleus tear or overuse. Affected patients typically report pain onset in the beginning of the exercise, which decreases with time. Sudden calf pain may also indicate deep vein thrombosis, which is potentially life-threatening medical emergency due to the risk of pulmonary embolism. The tennis leg is an injury that commonly occurs in tennis and squash players. It presents as a sudden sharp pain at the back of the calf that usually follows rupture of the myotendinous junction of the medial head of gastrocnemius. Less commonly, it's the rupture of the plantaris muscle. It's caused by overstretching the muscle by fully extending the knee and dorsiflexing the ankle. So, that was we meant by differentiating between soleus pain and gastrocnemius pain. Also, we have the Achilles tendonitis. This pathology involves pain induced by thickening of the calcaneal or the Achilles tendon at its insertion. It most commonly occurs in middle to older age people. It's caused by repetitive strain of the muscle, resulting in cartilaginous and bony metaplasia. Symptoms usually include pain in the back of the heel with a bony enlargement at the insertion of the tendon into the calcaneus. Also, this tendon can rupture, leading to Achilles tendon rupture, which is very common among people playing recreational sports. The rupture may be complete or may frequently be partial. Usually occur 4 to 6 centimeters above the calcaneal insertion. We also have the calcaneal bursitis. That's inflammation of the purses that separates the calcaneal tendon from the process of the calcaneus, called the calcaneal tuberosity. It can cause pain in the posterior part of the heel, and it's commonly the result of long distance running, basketball, or tennis. The third muscle of the superficial group of the muscles of the posterior compartment is the plantaris muscle. This muscle is highly variable for the fact that it's only present in 10% of the population, and for sometimes being bifid or have two bellies. This muscle runs in the posterior leg in the sural region and crosses both the knee and the ankle joints. So it's very long. This muscle originates from the lateral condylar line of femur and the oblique popliteal ligament of knee, inserted in the posterior surface of the calcaneus via the calcaneal tendon. So we can remember that the three muscles of the superficial group all made the calcaneal tendon or the Achilles tendon. This muscle helps in foot plantar flexion and knee flexion, innervated by the tibial nerve and vascularized superficially by the lateral sural and popliteal arteries, deeply vascularized from the superior lateral genicular artery. If we have to remember something clinical about this muscle, we just need to remember that this muscle is one of the muscles that can be taken as a graft, just as the palmaris longus. For the deep group, we have four muscles: the flexor hallucis longus, the flexor digitorum longus, the popliteus muscle, and the tibialis posterior. And because the flexor hallucis longus and flexor digitorum longus were also apart from the anterior compartment, we are not mentioning them anymore. We will talk about the popliteus muscle. This muscle is a small muscle that forms the floor of the popliteal fossa and is very deep in the sural region. The popliteal muscle plays an important role in the gait cycle by initiation the flexion of the fully extended knee. Thus, the popliteus is referred to as the key to unlock the knee. This muscle originates from the lateral condyle of femur, the posterior horn of the lateral meniscus of key joint, and inserted in the posterior surface of the proximal tibia, innervated by the tibial nerve and vascularized from the inferior, medial, and lateral genicular arteries, the posterior tibial recurrent artery, posterior tibial artery, and nutrient artery of tibia. As a clinical correlation, the popliteus muscle may be injured in conjugation with a rupture of the anterior cruciate ligament or injuries involving the lateral meniscus. These types of injuries most often occur in sports due to direct blow to the anteromedial aspect of the knee in the flexed position. Clinically, the affected patients present with an unnatural lateral rotation of the tibia when flexing the knee, and also they can complain muscle swelling, edema, or bleeding. The lost muscle is the tibialis posterior, which is the deepest and the most central muscle in the posterior compartment of the leg. It's located posterior to the tibia, fibula, and the interosseous membrane of the leg. Towards the ankle, the tendon of tibialis posterior is crossed by the tendon of flexor digitorum longus and lies medial to it as they pass through the tarsal tunnel. The muscle origins from the posterior surface of tibia, posterior surface of fibula, and interosseous membrane. To insert in the tuberosity of the navicular bone, all cuneiform bones, cuboid bone, basis of the 2, 3, 4 metatarsal bones. In this way, it helps in foot plantar flexion, foot inversion, and it helps in support of the medial longitudinal arch of foot. It's innervated by the tibial nerve and supplied by branches of the posterior tibial artery for vasculature. In this place, we have the tarsal tunnel, and we need to remember the structures passing in the tarsal tunnel, which are the tibialis posterior flexure, the digitorum longus, the posterior tibial artery, the posterior tibial vein, the tibial nerve, and the flexor hallucis longus. Up to here, we have finished all about the muscles of the leg. Thanks.